It's a pleasure to have you here. We're streaming live on DSTV channel 421, GoTV channel 144, and around the world at myjoyonline.com. We start off with some rather disturbing news as the head of Africa's Centers for Disease Control and Prevention, CDC, says the continent's case fatality rate has risen alarmingly to 2.5% higher than the global level of 2.2%. In a Reuters report, John Nkegasong told reporters that earlier in the pandemic, Africa's rate had been below the global average, adding the current rate is beginning to be very worrying and concerning. He, however, did not give reasons for the increase. He added the number of African nations with a rate of deaths per case is higher than the global average is growing. There are 21 countries on the continent with the rate above 3%, including Egypt, the Democratic Republic of Congo, and Sudan. Now, despite Mr. Nkegasong's concern, the World Health Organization's Africa head, Matshidiso Moeti, told an online news conference that Africa's case fatality rate was not dramatically worse than other regions. She said higher rates were probably due to the challenges African countries most severely affected by the second wave, notably South Africa, where a more infectious variant has been detected, were facing in providing care for infected people. According to Africa CDC data, over the past week, cases around the continent decreased by nearly 7% compared to the previous week, while deaths increased by 10%. And this information is courtesy the Reuters news agency. But, well, from South Africa, we've been joined by Dr Basitana Fora, who is going to share the South African situation with us, as you just heard in that earlier report. Thank you for joining us, ma'am. Good morning to you. Oh, I understand she's a journalist, actually, not a doctor. Apologies, ma'am. But tell us what the experience in South Africa is like with regards to COVID.
Well, COVID-19 certainly ravaged the whole world, and more especially South Africa, not only the African continent, but especially South Africa. Right now...
Hi, I can hear you, Fora. Hello?
Apologies for that.
Hello?
Apologies for that. As I was saying, that South Africa is currently going through mourning. We have lost our first minister to the COVID-19 pandemic, and you know the situation in the country is very volatile in this particular time. We are at the marking of more than 1 million positive cases since the beginning of the COVID-19 reaching the South African country.
We are told that the new variant is more contagious, and in fact, flights from your country to other European countries have been banned. Tell us how health centers are dealing with the surge in cases.
The amount of cases that are being reported basis are really scary. Level 3 lockdown. So what that means is that there's very minimum activity that is happening in terms of industries exporting of goods in the country.
We seem to have a challenge with the line there. Hi, Fora. Well, we seem to have a challenge with your line. We'll try reaching you because I'm interested in the South Africa case, because it is an example being cited for the surge in deaths or case fatality rates in Africa. I'll come back to you, Fora, while we try and work on that line. But that was Fora. She was joining us from South Africa. And as you just heard, they've just lost a minister to COVID, and they currently have 1 million cases. Well, we've also been joined by Professor Alfred. He's head of community health at the University of Ghana Medical School. Thank you so much for your time here this morning. Well, we received news. We have 658 new cases. Let's start off this way, looking at the impact on the surge in the numbers on our already burdened health facilities.
Yes, thank you very much. As we continue to say, it is very worrying and alarming. And at this rate, certainly our health system will not be able to cope. And once the cases are in the community and we expect that this new variant, as being more contagious and being more infectious, can spread from one person to other more rapidly. And we are beginning to see it is causing more severe disease in also relatively younger persons without any underlying comorbid conditions. And that's where the difficulty lies. And we need to take drastic measures. I think we need to go back to some of the important measures we put in place, limiting the number of social gatherings and the persons involved in these gatherings, and also the duration of these gatherings as well. It is important that if we are not going to wait until such a time that there is no alternative but to lockdown, then we need to take some drastic measures within the shortest possible time as we are in.
Is it not already time to lock down? My colleagues have visited the Ga East Hospital, for example, which was at the beginning of the pandemic designated for treatment of the disease, and it's full. I've had people tell me about how even doctors are struggling to get beds for their facilities. At what point should we decide to go on a lockdown, if not now?
Yes. Technically, you say there is no cutoff point, as we say, but we always need to balance the effect that a lockdown has on the general economy, and especially on vulnerable households, persons who need to go out there every day to go and work before they are able to get their livelihood, and also the impact on the national economy. So I think as the people, we still have opportunity once we comply with the mask wearing, social distancing, and the hand hygiene. Because the lockdown per se is not an all-in-all solution. Countries have locked down, gone back to lockdown again. Once we have the opportunity now, it behooves on us as individuals, as corporate persons, and as institutions to ensure that we are able to do the basic things that we need to do, and also go back to effective contact tracing, getting people into treatment. Even if they are at home, we ensure that they do not spread the disease. We still have opportunity to do that, and then curtail the rising numbers.
Prof,
Yeah.
let's talk about managing our cases. From your point as a community health expert, especially when we know that contact tracing is not being done as it used to be, are we handling this the right way at all? Or we are just leaving it a chance that by some interesting, miraculous way, COVID-19 will just leave us?
I think generally to say, we typically we might have relaxed or let down our guards a bit in all spheres of the front of fighting COVID. For example, in case management, we are still struggling to get the core cadre of staff who will be able to run our ICUs, intensive care units in the treatment centers and the new infectious disease centers that we have set up. These are things that we probably should have done much earlier. But probably because the cases reduced and were few in numbers, at a point we didn't have any inpatients, and probably that's where we slowed down a bit. If we had gone on with all the preparations and measures and put teams on standby, things like that, we will be in a better position to fight. Be that as it may, we still need to increase the effort, get as many personnel as possible to this side, and provide them what it takes. Whatever it is we promise them should be provided so that they are motivated or incentivized to, as they are sacrificing, and then they do it to support Mother Ghana. So I think there is more we need to get from our leadership and from the ministry and from Ghana Health Service and all interested parties, also from the public and the private sector as well. Private health facilities who are involved, private laboratories who are involved, that we all do our bit to support the national effort. But I think we really need to have a serious look and put emergency measures in place.
I appreciate your time this morning. Professor Alfred Osei is head of community health at the University of Ghana Medical School, and really disturbing pictures showing on our screens there. You can clearly see people struggling to cope. For those of you who think this is a hoax or a cooked-up story, I hope that these pictures convince you enough to wear a mask and to stay safe. Well, thankfully, we've been able to get Basitana Fora back. She joins us from South Africa to share the South African story. Thank you for joining us once again, Basitana. You were telling us about how health facilities in South Africa are coping with a huge number of infected persons.
Absolutely. Thank you once again. Yes, we were speaking on those challenges that South Africa is currently facing in terms of the high number of cases that are being reported on a daily basis. And, you know, one thing that is also being spoken of in South Africa right now is the vaccine. South Africans are anticipating the vaccine, and as per, expected, there are some who are saying that they are not looking forward to the vaccine. However, we have been listening to a lot of institutions who have been giving background as well as expertise as to why it is important for the country to receive a vaccine. And the South African government have announced that the first batch will arrive in the second quarter of the year, which means it will arrive in June. And the first people who are going to be prioritized are the essential workers as well as the prisoners, because as you may know, prisoners are confined in one space, and there's a number of them. Speaking of prisoners, one thing that has been happening in South Africa, especially when the first hard lockdown took place, is that criminals who were behind bars for petty crimes were, released from prison in order to relieve the number of cases that come from that side. But unfortunately, even such drastic measures that governments take, it's still not making a difference, considering the fact that so many cases are being reported and so many deaths are also being reported. And in South Africa, one trend that takes place, more especially when it comes to COVID deaths, is that people take it seriously once it is a celebrity, once it is someone who is, in the limelight, someone in the media industry has passed. That is only when people realize really the effect and the extent of COVID-19 situation. As I've mentioned before, that we are currently mourning the first minister to pass on due to COVID complications. His name is Minister Jeff Khatebe. He was the minister in the presidency, so he was very close working with the president of South Africa, Cyril Ramaphosa. So this is also, a very big wake-up call for the country.
But I mean, I'm quite embarrassed to say this, but we are struggling with compliance and adherence to safety protocols. So, for example, in his latest address, or his last address, the president directed our Inspector General of Police to ensure that his men were arresting people or enforcing the wearing of face masks or face coverings in Ghana. Do you have a similar situation in South Africa? Are people complying with the social distancing, the wearing of face masks and all?
Yes, absolutely. So South Africa is currently in level 3 lockdown.
Okay.
And part of the regulations is that one has to wear face mask, whether in public, whether at your normal business place where you work, everyone has to wear masks. And unfortunately, in South Africa, compliance is not really at a high rate. A lot of people walking around without masks. I tell you now, I am at a local hospital, at Pulusong Hospital, and I'm seeing people who are not wearing their masks properly. And that goes to show just how people are not taking the matter seriously. We were also told that police will have to enforce mask laws. Police have to enforce that there's social distancing in some places. But unfortunately, police themselves feel that they are at risk. I'll make a good example with myself being a journalist here in the country. A lot of police have been reaching out and explaining how they feel they are at risk for COVID-19 because they are expected to take care of so many people and to take care of people who are not abiding to the law. However, they feel that they do not have the resources to do so. For instance, they have to arrest people for not wearing masks. They have to handle that person. So they feel that they are not also given the enough resources to enforce the laws that are put in place. Generally speaking, in South Africa, the laws and regulations that have been put in place for the Labour lockdown are not listened to. For instance, right now there is a ban on alcohol sale, but there are people who are still drunk. How? We don't know. So it all goes to show that mask laws are not the only laws that are ignored, and that is why the cases in the country are going to go up and up and up.
I appreciate your time, Basitana Fora, a South African journalist. Please stay safe, and hopefully we will be speaking to you and get some good news even as South Africa battles the surge in coronavirus cases. She was just sharing the South Africa story with us. As you just heard, they lost a minister to the coronavirus pandemic. As you may be aware also, the variant discovered in South Africa, we are told by scientists, appears to be more aggressive, spreads faster, and quite lately we are being told could possibly cause more damage to the body than the earlier strains. Well,